Good afternoon, ladies and gentlemen. It's good to have you all with us this afternoon. We're very excited to be hosting this webinar in collaboration with the National Action on Sugar Reduction, the Health Federation of Nigeria, and the Nigerian Cancer Society, as well as our technical partners, the World Bank. This is the first in a series of 3 webinars. Today's webinar, we are focusing on whether Nigeria needs a sugar tax. As we know, recently the Federal Ministry of Finance put in place a tax, which will mean that going forward, about 10 naira will be put on a litre of sugar sweetened beverages. And as we know, this is aimed to stem the increase of NCDs. So over the next 3 web series, we will focus on specific aspects and really try and lead on why we feel that such a tax is very important. This afternoon, we have a very distinguished panel of speakers. Our opening remarks will be made by His Honorable Senator Mamora, who we hope will join us, but we understand that he may be a bit late joining us this afternoon. So once he's able to join us, then we hope to have him continue and really share some light on the importance of a sugar sweetened beverage tax, especially on the health implications. Then we have Mr. Fola Adiola, who will also be joining us. He's from the Fate Foundation, and we're very pleased to have you here, Mr. Adiola. He's chairman of Fate Foundation. And our moderator for this afternoon is Dr. Olumide Okunola, Senior Health Specialist at the World Bank. So without further ado, I'll just give you a brief background into the 3 web series we'll be having over the next few days. So the first one today, as I mentioned, is, does Nigeria need a sugar tax? Really, this will get into the nitty-gritty of the benefit of us putting in place a tax at all on sugar sweetened beverages. We know that discussions have diverged between, saving lives and livelihoods. On the livelihoods front, there opposition, which includes the economic cost of a tax in the industry and manufacturers. And on the lives aspect, I think we need to consider factors that contribute to non-communicable diseases like diabetes and cancer. So really, this tax on sugar sweetened beverages is aimed at saving lives, with 1 in every 17 adults in Nigeria suffering from diabetes. That amounts to about 11.2 million or so adults. There is clear evidence that we need to put in place interventions that modify the risk behaviors for NCDs, such as cardiovascular diseases and other malignant diseases. And often health interventions focus on mortality statistics, and these define many public health interventions and many public health measures. But there needs to be also wider discussion on the costs and benefits of health taxes. And we focus really also on the years of lives people have lost due to illnesses like diabetes. So we feel it's important that we also highlight these in these discussions about pro-health taxes, as often the economic argument does win sway. We know that obesity and diabetes, there is a significant cost to them and a cost to the health sector. So a pro-health tax really is aimed at mitigating some of those costs. And we are aiming that, we advocate that the taxes raised will be earmarked for the health sector. So today you will hear a variety of speakers bring to board a lot of the critical issues we need to focus on. On the 27th, on Thursday, we will now focus on building strong advocacy campaign for sugar taxes. Many of you, I'm sure, who are on this session this afternoon work in the health sector. So the health argument will not be lost on you, but we feel that it is important that we broaden this discussion to a much more wider audience beyond the health sector, so that there is a clear understanding of the importance of putting in place a pro-health tax, such as the one that's been put in place. And finally, the 3rd webinar will now address the increasing prevalence of NCDs in Nigeria. And this will really dig deep into the actual disease burdens of a lot of the NCDs that we talk about, and the impact that sugar sweetened beverages has on them. So I think, we hope that over the next few webinars, we're able to really speak to a broader group of stakeholders who will help in supporting ensuring that this tax actually gets pushed through. And despite any industry opposition, we all know the importance of protecting the lives of Nigerians. A healthy Nigerian is not a productive Nigerian. And ultimately, with more funds coming into the health sector to meet some of these rising costs, such a tax we hope will address this. So without further ado, I will just welcome the moderator, Dr. Olumide Okunola, who will be moderating the panel discussion. And he will take you through the different speakers who will be joining us. And we're very proud to have them join us as they bring a wealth of experience in talking about sugar sweetened beverages and other pro-health taxes. So before I go further, I would like to also just highlight a few housekeeping rules. We'd like you to really listen, engage. In doing so, please drop your questions. You can say hello and just let us know who you are in the chat function. It's always lovely to know who's joining us when we do these webinars. But for the question and answer session, please add your question to the Q&A function. And if you see a question that you may have asked or you want really answered, you'll see a hand that points up. If you click on that, it will upvote that particular question. And in doing so, then we make sure that when it comes to the question and answer session, your question does get answered. I think that's it covered in terms of, welcoming everybody. On behalf of my team at Nigeria Health Watch, we're all pleased to be supporting and hosting these series of webinars. So without further ado, I will hand over to Dr. Okunola, who will take over and introduce to the opening remarks and also to the speakers who will be all listening to. Thank you, and over, Dr. Okunola.
Thank you, Vivian. I don't know if you can hear me well.
We can hear you.
Thank you very much. To give the opening remarks this afternoon, we have the Honorable Minister of State Health. We are lucky to have Dr. Senator Mamora as minister at this time, and this is why I say so. He has been a major advocate. The success that we're celebrating today, in fact, emanated from the work that Senator Mamora and the team at the Federal Ministry of Health has done. I recall sometime last year, Senator Mamora led a team of directors from the Ministry of Health to have a meeting with the Minister of Finance whilst the Finance Act was being articulated, making a case for pro-health taxes. So I think on behalf of all of the advocates and stakeholders on this call, I would like you to join me in thanking Senator Mamora for being a champion for this cause. And he has brought his legislative abilities and capabilities to this policy issue. So I'd like to invite the Honorable Minister of State Health, Dr. Senator Mamora, to give his opening remarks. Dr. Mamora. I can see Dr. Mamora connected, but I want to assume maybe he's not ready to speak yet. So whilst we find out what's going on, I will move on to our next special guest of honor, who might be known to some of us on this call. Mr. Fola Adeola is a co-founder of one of Nigeria's largest and biggest banks, the Guarantee Trust Bank. But perhaps not many will know that Mr. Fola Adeola is the architect of the what has now grown to become one of the largest pension industry on the continent. And I do hope that coming from a deep wealth of private sector expertise, Mr. Fola Adeola can share some insights on the issue of pro-health taxes. Mr. Adeola.
Thank you very much. I hope everybody can hear me. Can you confirm?
Yes, sir, we can hear you and see you. Yes.
First of all, let me commend all those that have been involved in putting this together. It's part of what makes a society when we have causes that are greater than our own self-interest to pursue. That is the basis for a legacy. Congratulations. I will never lose on causes like this, whether we get to where we want to go or we don't live where we are now. We are always winners because we are thinking of how the society can be better. My understanding, which is based on science, is that a substantial number of premature deaths in Nigeria today could be prevented by reducing consumption of three products: tobacco, alcohol, and sugary beverages. One of the works that I've done, as you have mentioned, is the pension reform. And I believe such a similar level of ambition is required to have social health insurance at scale. It's not just something for one or two NGOs pursuing. It's at scale, nationwide. And I'll give you an example. I understand a packet of cigarettes in Lagos costs 400 naira. A similar packet in London is 13 pounds. 13 pounds. If we say 1 pound is $700, it means that you can buy 2 packets of cigarettes here, almost, with 1 pound. And you can imagine how many packets you can buy here with 13 pounds. That is a kind of disincentive that they have put on cigarettes in the first world. Okay. We need something significant here. In the absence of such social protection efforts, prevention is better than cure. An additional benefit of this is the preventive efforts lead to saving of costs in the long term. If we find people healthy, alive, then the workforce is improved and output is improved. And the whole thing is a whole ecosystem. Public financing is key for human capital development. An additional revenue that can be obtained from such tax increases, while secondary to the health gains, are substantial. But I'm also suggesting that whatever revenue we get from these taxes should not just be put into anything. It should be put into the improvement of the wellness or the well-being of our citizens. I applaud the new tax. I think it's a good and commendable idea. And I align with the policy as it is underutilized, yet highly effective in reducing tobacco, alcohol, and sugary beverages in terms of their consumption, and reaping huge health benefits in both the short and the long term. Lastly, I want to restate the point that I made earlier, that these taxes should be channeled into the improvement of the healthcare ecosystem, such that when the consumers of these harmful products fall prey to illnesses, we have the facilities in place to take care of them. I think it's a no-brainer, except that those who are either selling or consuming are also going to form a counter-advocacy as to why it should not be. And the arguments they are going to make will include is providing jobs. Our counter-argument is that illness is a bad job provider. Death is a bad job provider. We cannot be losing our people to illnesses and deaths because we are getting work for our people. That is not what we are about. I want to conclude by thanking everybody and to say to you that I will support in getting as many people, as many voices to talk to these issues, because I don't think it should be difficult to talk to, even though I know the obstacles are very, very high, but we'll scale them. is just to begin, and that's what you have done. Congratulations and thank you.
Thank you very much, sir. It's such a pleasure to hear such inspiring words from you. Again, Mr. Fola Adeola is a co-founder of Guarantee Trust Bank, and he's also one that can be described as the principal architect of pension reforms in Nigeria, which has grown to become the largest pension industry on the continent. So this is, Mr. Adeola can be described as private sector personified. And where we have such a strong support and such affirmative statement from a major private sector player, then it shows that there indeed is hope. Thank you very much, sir. Again, we're on the lookout for the Honorable Minister of Health State as soon as he connects. We know he's juggling a number of meetings, but he has committed to be on this webinar to share what took us to this point and what the next steps are. So without much ado, we'll go on to invite my colleague, Kate Mandeville, who has joined from Beijing, China, where it's about 9 o'clock now. Kate is a senior health specialist with the World Bank and is one of the leading global experts on sugar sweetened beverages. Hello, Kate, and thank you.
Thank you so much. Those are very kind words. And I'm really, really delighted to join you here tonight. I think this is going to be an excellent set of webinars, and I'm very pleased to be kicking you off on this first one. So I've got a short number of slides, and I'm just going to share those with everyone. That should be viewing now. Let me know if there's any problems. So I'm going to put the case to you in 10 slides or less as to why Nigeria needs a sugar tax. And I think the first point to mention, to follow up on the first speaker, is that I think the primary word of tonight will be congratulations. Admittedly, this is the first step in a long process, and I know there's been a sustained opposition since the announcement, but this really is a huge step forward for the health of Nigerians. So congratulations on behalf of the World Bank for this achievement. And what this represents, the announcement of the tax on sugary drinks, is membership of an elite club of other countries who've taken this step. Well, in fact, it used to be elite. It's no longer elite because many countries have joined. So it's now like a club with no door policy. And that's because many countries are seeing how effective sugar taxes can be to both improve population health and to raise revenue, which can be directed to many societal goals, including improving the health system. So this map here, in fact, is a little outdated. I'm waiting for our new map to arrive. But this shows the spread of sugar taxes around the world. Back in the 1940s in orange, only one country had a sugar tax at that point. Through to the 1980s, it spread a little bit. You can see in green through the 2000s, and then in the 2010s, the last decade, it really took off as an intervention. Many countries saw the benefit of this. We haven't even got to the 2020s yet, so Nigeria will be one of those on the new map to be included. And in fact, the new number now is 66 countries around the world have a targeted excise tax, the same structure that will be used by Nigeria. And targeted means that, from our definition, the tax distinguishes or makes a difference in prices between sugary drinks and unsweetened water. So thus creating that incentive to move over to a healthier substitute. And why are countries targeting these sugary drinks? Well, because although there are many products, including many food substances, that are high in added sugar, cakes, sweets, etc., sugary drinks are quite unique in that there is no other nutritional value in them. They're simply empty calories. And more problematic, they're empty calories and added sugar in liquid form. And when you ingest that, that sugar immediately rushes into the bloodstream, spiking up the blood glucose and causing havoc with metabolism. I mean, the other distinguished speakers on the panel will be able to elaborate this much better than I myself. But the evidence shows that actually when you consume calories in liquid form, you tend not to compensate for that in your solid intake. So you don't, if you eat solid food, you tend to feel full and you'll compensate by eating less later. It's not the same with drinks. And so that sugar and that energy being taken in is not compensated for elsewhere. And that's giving rise to that increase in obesity, which was mentioned and described by Vivian and will be described in the third seminar in this series. So it really, this very discrete, narrowly defined category has a lot of value as an initial step towards a comprehensive package of policies that combat non-communicable diseases. And what we have now is the evidence base to support that. In contrast to tobacco and alcohol, two other unhealthy substances which are commonly taxed, they have evidence bases which go back decades. There's an absolutely strong case for the association of their consumption with poor health. That wasn't the case with sugary drinks until really the last couple of years. And that evidence now is fairly solid. So I'm just going to cast your eye to the left-hand column here. These health outcomes, again, these are described by Vivian, is what regular consumption of sugary drinks is associated with. Obesity, I think that was 12 million people, is that right? 11 million people living with obesity in Nigeria. Type 2 diabetes, 1 in 17 people living with diabetes at the moment. And let's not forget about simple tooth decay. It seems in contrast to these other conditions, a less severe outcome, but dental health, oral health and tooth decay can lead to grave problems in nutrition, to pain, to hospital admissions for children to extract these teeth. And then going down that list, cardiovascular disease, cancer, and all-cause mortality. So this evidence base is there, and this evidence base is solid. And why we're concerned and working on this at the World Bank is that the consumption of sugary drinks against that evidence base is increasing across most regions. And you'll see from this graph that actually the only region where it's decreasing is North America. In Europe and Central Asia, it's fairly stagnant. But in the other regions of the world, Latin America, the Middle East, East Asia, and of course, Sub-Saharan Africa, it's an increasing consumption. And we know that as consumption drops off in high-income countries, there is a strategy of switching to emerging markets and targeting those markets with more advertising and more investment in growing that consumer base. And Mexico was faced with many of the same problems, in fact, a very similar context to Nigeria, a growing burden of non-communicable diseases, obesity, diabetes, rising healthcare costs. And it really took the very bold pioneering step of a sugar tax, which opened the floodgate. It's really seen as a turning point in this policy. And it actually used exactly the same structure as the Nigerian tax. It's based on volume, it's a specific tax, and it's a little bit more, so it works out about 12% increase in prices. What it did do was include more products, so it was on all sugary drinks, and then it excluded specific drinks which could be viewed as substitutes, so which people would turn to as healthier replacement drinks. That included 100% juices, diet drinks, low or zero calorie drinks, and dairy products. I know there's a debate at the moment about what products will be included in the tax, and I would recommend this is a very good basis and serves as a rationale for including all those drinks with added sugar and excluding those that can act as healthier substitutes. The evidence shows for Mexico is that actually even in the first 2 years, there was a considerable reduction in sales. And the greatest reductions were in the poorest and the highest consuming households. There was no evidence of a negative impact on employment. That's very important because I know there's been a lot of discussion about that since the announcement in Nigeria. And the latest evidence, excuse me, shows that medium and high consumers decreased from over 50% to 43%. Non-consumers, those who didn't consume sugary drinks at all, increased to 14%. And most remarkably of all, there is evidence now of decreased weight in adolescent girls. And that is remarkable because it is one of the first population health outcomes that has been seen from SSB taxes. What I want to demonstrate now is that while most attention has been given to the increase of prices that result from SSB taxes and how that would push through to decreased consumption, there are actually complementary measures, complementary pathways for which sugary drinks taxes have impact on the population. So the second major impact after increasing prices is raising public awareness, merely the debate about whether there should be an SSB tax, as well as the discussions when that's being designed and passed and implemented, will increase that public awareness that sugary drinks have negative health impacts and are unhealthy products and should not be consumed. That's really, really important. It's a signaling effect, which can be as strong as the price impact. The third pathway, which again is less well known, is incentivizing the industry to respond in ways that are not simply due to price. And that includes lowering the sugar in their drinks that they offer, switching from sugary drinks to non or lower sugary drinks in their portfolio, because remember, many of these companies produce both sugary drinks and non-sugary drinks, such as bottled water, and switching their marketing from the higher sugar brands to the lower sugar brands. And I'll give you an example of a country where this has been used to great effect. And then finally, of course, generating government revenue, which can be used towards producing improved welfare. And just an example of that last one here is from South Africa, as you know, introduced a very successful sugary drinks tax. The revenue is modest compared to alcohol and tobacco. As you can see, the percentage of general tax revenue on that right-hand column there, for sugary drinks compared to alcohol and tobacco is 0.2%, but it is additional. It's additional, and during COVID times and deficits in many countries around the world, every additional source of revenue helps. And just to end, I want to describe another success story to you, my own country, the UK. And this could be, from the research we're doing at the moment, it's become evident that sugary drinks tax evolve. It's not a stagnant one-time introduction. These taxes can be introduced and then evolve into stronger forms, which have more population impact. And it's possible within the structure that Nigeria has introduced to do that, to add another tier eventually down the line. The UK did this initially. It introduced 2 tiers as saying those drinks with a higher sugar content get a higher tax rate. Those with lower sugar content get a lower tax rate. And that was really deliberately to incentivize that non-price response I described, to push manufacturers towards lower sugar products. And it worked. It worked so well that both the sugar content of the drinks decreased much more effectively than it ever did under a voluntary sugar reduction program. But the volume of sales of sugary drinks didn't change. So there was absolutely no impact on business. And the reason for that is that people don't become less thirsty. People will still want to drink drinks, whatever sugar content they have. And so all those consumers still had their cash to burn, and they switched from the more expensive, higher sugar content drinks to the lower sugar content drinks. And in that way, the UK sugar tax has been a win-win, a win for population health and a win for business. Thank you so much for listening to me. I'm really looking forward to hearing the rest of the discussion. And please let me know if there's any questions.
Thank you so much, Kate. That in a very short period of time, you've been able to lay out the case on indeed why Nigeria needs a sugar tax. You've argued quite eloquently that this is a kind of double advantage. One, it improves population health. On the other hand, too, it also adds real additional financing into government coffers. But there are also a few things too. Even though you shared the numbers from South Africa, looks like a tiny amount in terms of contribution to GDP, but that's $140 million. That's additional financing for the health sector, for instance, could amount to a lot. In fact, if you look at Mexico as well, in 2017, the taxes on sugar sweetened beverages raised $250 million for Mexico. So it might look small compared to what alcohol and tobacco can raise, but overall, they in fact do provide additional revenues for public financing. And perhaps, if we're lucky, it might be for the health sector in Nigeria. Another point I take from your presentation is this is not a one-off tax. This is a discussion that needs to be had on a dynamic basis. It's not a conversation that just ends there. Right now, the 10 naira per liter, whilst it's a good window, it is particularly very low. For instance, if you look at a bottle of cola in Nigeria, all it adds, this tax to a bottle of cola is 2 naira 50 kobo. And yet, these taxes are meant to serve as a deterrent. It's meant to reduce consumption. So, but I think people on this call will agree with me that this is a first step. It's an early step. It's a good step. And our work has only just begun, because we now need to develop a body of work in terms of advocacy, in terms of evidence, in terms of data, to better work with our legislators, with the executive, to make sure that year on year, we're able to raise the taxes to a level where, in fact, consumption will reduce. So at this point, I will just like to very quickly move on to the panel, and I have a real rich set of panelists this afternoon. They span from clinicians to advocates and to key stakeholders in our sector. So the first person I would like to bring on board is Her Excellency Zainab Bagudu, First Lady of Kebbi State, board member of the UICC, and CEO of Medicaid Radiology and foundation. So she's a major private sector player. She's one of our leading advocates, but she's also a global advocate, being a Nigerian who sits on the board of UICC. But the reason why I'm asking you to speak first, Your Excellency, is that already before now, you play a major role in preventive activities. You organize walks, you raise money for cancer patients. What or how would this fiscal policy, this tax on sugar sweetened beverages, how will it help the work you do on a daily basis?
Okay, good afternoon, everyone. Thank you for inviting me on this panel and to the organizers of this first in a series of webinars, and indeed to all the advocates and supporters of this particular issue on our health, that affects our health to a great extent in Nigeria. It's been through quite a long journey, and we're pleased to see that the government has decided on this occasion to include a tax on sugary drinks, particularly carbonated drinks. And as an advocate and someone that is very active in the national and global cancer space, this brings a lot of joy to me, as well as I'm sure it will to all the other advocates that are involved in non-communicable diseases. This is the first step, and to start to answer your question, Dr. Olumide, policy is always the beginning, and having the right policy in place is what pushes us to continue to advocate and to raise the funds and to make the necessary interventions that will help the overall outcomes of any disease, and in particular non-communicable diseases. One thing that we often underscore, we don't realize the global significance of in the Nigerian space, particularly the political space and legislative space, is the relevance of political will. There are lots of impressions that are held, or impressions that can be brought into any system merely by looking at the policies of a country. For us to sign up on maybe the Health Acts, the Child Rights Acts, the All Protective Women's Laws, and so on, it takes a lot. And that political will of actually doing so makes a difference. And it helps to affect the overall continuum of care when it comes to cancer control. So I think that the first thing that we appreciate about this is that it shows that Nigeria is joining the active nations that want to do something about their health conditions and want to intervene to have better outcomes. We've heard some presentations about countries that have done this successfully, and definitely we know that there will be some opposition, but to have 66 countries in the world doing so and to be backed up scientifically by facts, and now we're even having evidence that the countries that have done it are not losing revenue. The greatest argument against it is that there's loss of labor markets, but we're just asking you to not add as much sugar or to not sell as much cigarettes. So to me, there's no reason why the labor market should be reduced. And we can see this, as Kate presented just a few minutes ago, happening in the UK, whereby there is no impact a year later on the labor market, particularly with the sugar industries. So I think this is the first thing, the fact that it puts the nation in good standing and shows that the political will is there to do better things about that. Now, when we talk about advocacy and general disease conditions, the whole continuum starts from prevention to the diagnosis, to the treatment, and then for us in cancer care, the palliative care as well is quite important. So having in place government policies that address each of these steps is always very useful. And it helps us as people that connect with the general population to be able to carry out our programs easily and to be able to convince the people. We could say, oh, eat less sugar, it's bad for your health, but without reducing the amount of sugar in our drinks that we're consuming, we're still bombarding our population with all this sugar, and the eventual result is going to be the same on their health. So definitely any pro-health tax is welcome by us, and we hope that there will be a continued increase. I don't want to use the word increase, but a sustained effort to continue to tax these agents that have been scientifically proven by research over time immemorial to be harmful on health. It helps us, government policy also helps us to be able to, of course, the obvious benefit is that we will have better outcomes. We will have less people dying from sugary related diseases such as diabetes, hypertension, cancers. It's been found that at least 16 cancers are directly related to consumption of large amounts of sugar and obesity, directly or indirectly. So this is very relevant. And if we're able to do that, then we'll be able to do a lot better. There are also incentives that come to either organizations, countries, directly to people, even your own personal insurance. If you smoke, your insurance premium is going to be much higher than that of a non-smoker. We don't have that on sugar yet, but obviously an obese person that is seeking a health insurance for the first time is going to get, if your BMI is above a certain number, 35, you're going to be charged higher because automatically you're at risk of getting certain diseases like we've been talking about. And these all have effects directly on your income, your ability to spend, and of course, outcomes of your health. So this puts us in a better light, and it helps people to give that extra incentive to show that you need to do a bit more, and by the government enforcing it on us, then it makes us realize that we need to do quite a lot more. So I think in summary, it's important that we continue to advocate for the right policies. We continue to support our governments to talk about, to enact the right policies that will help us have better health outcomes. In this case, the sugar tax, as has been enumerated by every speaker so far, is a very welcome one. We hope that it will be sustained and gradually increased, as the case may be, and spread across all sugar-containing products, not just the carbonated drinks, so that we can positively see the impact on our health. The last thing I want to emphasize is the need to ensure that these taxes or the revenue that is derived from this extra taxation is used directly in the health sector, especially in the indigent population. It's been shown, like I'm sure in Mexico, that spending these resources in the underserved communities who have the greater health needs will definitely improve not just their health, but it also puts the government in better standing and helps to move the government policies on better. So once again, thank you for asking me to speak about this, and I hope that we will be interacting more on the webinars that are coming in future. Thank you, Nigerian Health Watch, and well done.
Thank you very much, Her Excellency, Dr. Zainab Shekafi-Bagudu. Very well said, very well said. I also, like you mentioned, Echi, that the next webinar comes up on Thursday, where we'll be engaging a lot more with our media advocates. There are quite a number of them on this call, Chukuma Mwaya, Uche, quite a lot of journalists are on this call because we know that the industry is pushing back. For instance, some of the scientific peer review papers are actually being questioned. And I see some of the questions in the chat box. But I will pause from the panel now. I can see that the Honorable Minister of State Health has joined us, Dr. Senator Olorunimbe Mamora, whom I must say again played a major role in the successful passage of this law in the Finance Act of 2021. I'm very aware that he led the delegation to the Minister of Finance advocating for this law as part of Nigeria's universal health coverage effort. And we'll speak to that a bit more. Honorable Minister, sir, if you are ready to give your remarks.
Thank you very much for asking me to be part of this conversation in respect of an issue that's been out there, well, with various names, sin tax, pro-health tax, name it. But I ask myself that I don't know whether the jury is already out there as to appropriate nomenclature. But whether or not, maybe it's just appropriate to call it a pleasure tax. Because the issues involved, oftentimes people see it as pleasurable. Well, that's just by way of an aside. But I want to thank the organizers for considering it important to host this session at this point in time. We're all aware of the scarce resources available to us as a nation. And even within the ambit of the scarce resources, there are numerous competing needs. And as critical stakeholders, we have important roles to play in exploring innovative, flexible, but sustainable mechanisms to mobilize and galvanize additional resources for the sector. And we're talking about the health sector, where we need to do more in terms of what we need to do in providing services, not just for the physical structure that are needed, but even for services being rendered by the human resources in the system. So that is why this issue has become so topical. And our role is not just to mobilize these resources, but we must also actively work to negotiate that these resources, when made available, they are ring-fenced for the sector, that is the health sector, specifically on a sustainable basis. I know that we have explored several strategies in the past, and we're still exploring even at the moment. But the pro-health tax is a low-hanging fruit, and we must not allow this to slip off, considering that we could also use it as a public health instrument to reduce the burden of non-communicable diseases as a whole, which we are battling with right now. Just yesterday, we were talking about trans fatty acids, which is another area that's also germane to what we are discussing today. Well, so many efforts that we have tried to put in place from our end, that is the Ministry of Health. Such efforts as stakeholder engagement to sensitize and enlist support of the private sector in particular. Of course, we have also held strategic meeting with the Minister of Finance, Budget and National Planning, and her technical team on modalities for instituting these taxes. And of course, assessing and utilizing the funds for healthcare interventions. I'm also aware that through the National Council on Health memo, this issue was presented at the last special National Council on Health meeting here in Abuja. And there is currently a financial sustainability plan for the sector that is currently being developed, and it will further reflect strategies for utilizing funds from these taxes when made available. And at the moment, I'm aware that the Federal Ministry of Health is currently finalizing plans to convene a wider stakeholder engagement as part of the advocacy and sensitization strategy. So to this end, I want to reiterate that the realities of diminishing resources, these realities are with us. And we have no choice than to act now. Now, not tomorrow. And in doing that, we also need to act fast. So, ladies and gentlemen, on this platform, on this call, while thanking you, I also wish that we commit ourselves more than before to engage and enlist the support of all critical health, not just health, all the stakeholders in this regard, both in public and private sectors, so that we establish partnerships that will help us to push through this a very, very desirable and very important issue that we are called upon to spearhead at this point in time. And in so doing, we're not just working for ourselves, we are working for a better society that is healthy. And when society is healthy, particularly in terms of what we are offering, the services, and that definitely will improve the productivity of the system. But the bottom line to achieving all this is garnering the appropriate resources and utilizing these resources in an appropriate way. And of course, factoring in, most importantly, sustainability, because it is not and it cannot be once and for all activity. It is that sustainability that will stand to benefit from, and greatly too. So it's on that note, I want to thank you for giving me this opportunity to just share a few thoughts. I hope I have further stimulated this conversation, and I believe that we're in it together to see that we carry it through. Thank you very much.
Thank you very much, Honorable Minister. Very grateful for your insight and for your comments. In fact, as under your leadership, the Federal Ministry of Health is moving and implementing reforms necessary for Nigeria to achieve universal health coverage. And if there's one thing we know about universal health coverage, it cannot be done without public financing. Yet, in a constrained fiscal environment, where will the money come from? And I believe that indeed some of the pro-health taxes that we're talking about today would certainly contribute towards that process. Like Kate had shared earlier with us, South Africa is raising just about $200 million. Mexico, Philippines, they are raising substantial amounts of money. Yes, in the grand scheme of things, it could be small, but indeed contributes to that process. Indeed, thank you very much, Honorable Minister, for your time. And we do appreciate your leadership on this critical policy agenda. We then move back to the panel now, and I would like to call on Dr. Keke Akiroye, the President of Nigeria Heart Federation, just to give us some insight into what the prevalence of non-communicable diseases is in Nigeria. Should we really be worried? We've heard the comments made by Dr. Bagudu. We've had some of the comments that even I'm seeing on the chart here in terms of increasing prevalence. Is this true, Dr. Akiroye? And if so, what role will these taxes help in bringing the prevalence down?
Thank you very much, Dr. Olumide. And I also want to thank the Healthcare Watch for this occasion and for inviting me, and also especially people living with non-communicable disease. I want to take just a second to thank the Honorable Minister for being on a very long journey, Dr. Senator Mamora, for what you have done in the area of looking at the risk factors, especially your experience with tobacco, and you are making it again with sugars, with SSB. Thank you very much. We all know what are non-communicable diseases, and that these are a group of health conditions that are not typically caused by acute infection, and they result into long-term consequences for health. This has been with us since 2011, and the UN highlighting this, the importance of NCDs, which we are now. And of course, in Nigeria, the 6 million NCDs are well known. Heart disease being number 1, diabetes, cancer, now chronic respiratory disease, sickle cell disease, and mental health. Dr. Bagudu also mentioned, retreated. We have 76.2 million Nigerians living with heart disease, especially hypertension, about 12 million people living with cancer, and living with diabetes. And lately too, we also have the data that about the 1/3 of the adult population die from non-communicable disease, of which 70% of these are cardiovascular, cancer representing 3%, and diabetes 3%. So this is just to say that NCDs is a concern for Nigeria. In addition to that, COVID-19 has also emphasized this, because we know that since the onset of COVID-19 in Nigeria in 2019, the majority of people that have died from COVID-19 have been from heart disease, diabetes, and cancer. So these comorbidities are with us, they're existing with us, and we have to face it. In addition to our poor primary healthcare system, which is really challenging to us. We have the human resources are not there. Funding is not also just with us. Was also thank Dr. Mamora under his leadership. The Basic Healthcare Professional Fund is now in Nigeria. Not many states have already enrolled in it, but it's still a push ahead. So we have the opportunity to be able to get more financing from what we are discussing. Again, globally, you know that the risk factors for NCDs have been highlighted, and unhealthy diet is number 1. Tobacco is what we have also mentioned. So what do we do in fighting NCDs in Nigeria? I've just mentioned to you that overweight and obesity are all diet related. So by poor dietary habits tends to encourage this non-communicable disease. And that is through consumption of sugar, sweetened beverages, which are linked with developing of obesity, heart disease, and diabetes. And scientific studies, which you have mentioned, have showed us that a reduction of this will bring a reduction of obesity, type 2 diabetes, hypertension, and also cardiovascular disease. We also know that excess SSB consumption also generate both a personal cost to the individual, to the family, and also to the healthcare system. And we shouldn't know that our primary healthcare system, which was supposed to be the first one, is still underfunded, and funding is very, very important. So effective implementation of the 10% taxation of the SSB by the Nigerian government will go a very long way to increase the lowering cost of healthcare and improve the healthcare of the population. Just lately, WHO just give us a data that if you invest $1 per person, which is less than 500 naira per person in Nigeria, you are going to save 700 million lives from heart disease, from cancer and diabetes by 2030. Now that we have a target to be able to achieve. So investment in non-communicable disease, there's no other way for us to live longer, to increase our life expectancy and to have a healthy population. So the sources of healthy revenue, which have also been discussed, should be towards this. What I really want to add, we should face that this fund should be, majority of it should be used for people living with NCDs. That too, I do expect that I represent today while talking to you. And I do know that more than 120 million Nigerians are living with non-communicable disease, and also to improve our healthcare system. Thank you very much. Thank you. Over, Dr. Lumide.
Thank you so much, Dr. Akinroye. You know, despite some of the data that you've shared, some of this data, we're very familiar with it. We're still getting comments that put some of this evidence in doubt. And I will really hope that at some point we'll be able to share, even in a scientific setting, some of the robust evidence and data that we have in terms of the linkages between these harmful products, alcohol, tobacco, sugar-sweetened beverages, and non-communicable diseases. In fact, perhaps we should even address some of these concerns frontally. Dr. Pamela Ajayi, who is in the private sector, currently the president of the Healthcare Federation of Nigeria, and also running a chain of diagnostics clinics across the country. She's also a media communicator. I would like you to share some of your views in terms of the arguments being put forward by industry, you know, saying that the introduction of these taxes affects employment, affects revenues. What's your take on this, Dr. Ajayi?
Thank you very much. I'd like to say a very big thank you to the organizers for giving me the privilege of being on in this conversation at this time. Now, the sugar tax is actually well known now as a health tax, otherwise known as a sin tax. And it's one of those taxes, along with tobacco and alcohol, that actually has a negative public health impact, even though some people on the call are debating this. But the aim of having a health tax is to improve population health through the reduced consumption of unhealthy products. Now, the best studied globally is actually the tobacco industry. And this argument for many, many years was used by the tobacco industry and its representatives to actually block people from creating the tobacco tax. But since then, there have been a huge amount of studies that have come out to show that money not spent on tobacco is actually used on other goods and services, thereby creating additional jobs to offset the job loss in tobacco-related sectors. And these measures of tobacco control had actually very little impact or even a positive impact on employment, except in some agrarian countries which were heavily dependent on tobacco farming. Now, I will move away from tobacco and go directly into sugar. A reduction in sugar use does not affect everyone whose job is related to sugar in an equal manner. So for example, looking at the advertising industry, the sugar products are heavily advertised products, and a fall in demand for the sugar product advertising may lead to an issue. You know, that's the worry, maybe a smaller advertising industry, but actually it will not do so because an advertising agency can find new products to advertise if the demand for its services from sugar products falls. But that actually has not been shown to be the case. For example, as Kate told us in the UK, the advertising continued, but for lower sugar beverages, and then the switch was made. Or in fact, in the US, in the case of tobacco, it was shown that an increase in billboard advertising happened after the tobacco was dropped. So how do we understand who is affected by this tax? Those who are most susceptible to the negative impact of reduction in sugar consumption are those who work indirectly related to sugar consumption. So if I can classify it roughly, those directly involved would be those who are involved in 1, sugar farming, 2, sugar processing and marketing, 3, sugar product manufacturing, and 4, sugar product wholesaling, retailing, etc. And I would want to point out that actually Nigeria does not produce much sugar. In fact, sugar is actually produced abroad. We import most of our sugar. So in fact, a reduction in sugar would mean a reduction in foreign exchange spent on the importation of sugar, which can actually be beneficial to our economy. And because we don't produce the sugar, we also don't process the sugar. And most of the time don't actually market sugar directly. Most of the issues, in fact, a lot of products that are produced by sugar are not produced here, but the specific one, which is the beverage, is so it would only be the last item in terms of sugar product wholesaling and retailing that would actually be affected. But all the other areas, since they don't actually affect us because we don't actually do them in this country, or mostly it is done abroad, then the impact would be very low. And has been shown by Kate again, using the UK example, a simple reduction in the quantity of sugar that is put into those drinks would actually make a huge impact. And if you look at, or has for anyone who has ever tasted the Fanta sold in the UK vis-a-vis the Fanta that is shown here, I think you can testify to the huge amount of difference in the amount of sugar in the drink. So that would also go a long way to improving the health in the type of drinks that we actually have. And as she actually demonstrated, in Mexico, it's actually been found to have very little or no effect at all. So with the UK example, with the Mexican example, we can actually see that this is actually a huge plus for us, or potentially a huge plus for us if we can get a reduction in the foreign exchange on importation of sugar. And more importantly, if we can ensure that this tax is actually earmarked for healthcare, to provide healthcare for the indigent. I would want to support the words said by our distinguished Senator Mamora, who actually said that it should be used in healthcare. And in the Philippines, earmarking for healthcare of these taxes was actually shown not only to have to be a significant source of revenue, tripling resources for healthcare over a period of 5 years, but actually these earmarks have helped to decrease smoking prevalence and to improve equity, and by expanding coverage and paying for health insurance for the poor. And as we know, there's a huge problem with our healthcare coverage, with the issues with health insurance, with provision of healthcare and healthcare infrastructure. And so if you add that to the fact that we need care for our indigent. We need additional funds for the NCDs as spoken for by Dr. Akinroye. We need funds for cancer as spoken for by Her Excellency Dr. Bagudu. You can see that this is actually a huge plus for us and not a minus if the funds are properly used in the right way in healthcare. Thank you.
Thank you so much, Dr. Ajayi. Such an impressive and eloquent argument. I can see that a couple of people from industry who have joined this call. We welcome them. I can see some of their comments. Most of these comments are putting to test and doubting the science behind several of the things that we're discussing on this call. I would just like to add or contribute to what Dr. Ajayi said. One of the arguments that also being brought forward is that these taxes disproportionately affects the poor and vulnerable. That again is something that has been debunked. Like Dr. Ajayi said now, and also Mr. Fola Adeola said, the level of health insurance coverage in Nigeria today at best is about 5%. The poor and vulnerable are not covered. In fact, where you then have a rising prevalence of non-communicable diseases, and they suffer the consequences of these ailments, there is no minimum social floor. There's no social protection. So, in fact, this fiscal policy is then a good thing, because if it serves as a disincentive and people reduce their consumption of alcohol, reduce their consumption of tobacco and sugary sweetened beverages, and they do not get diabetes, and they do not get hypertension, and do not end up with the complications of either of those, either in renal failure or stroke, then you have saved those individuals or households. You've taken them out of poverty. This, I believe, is the big picture that we need to focus on. I wanted to bring on board Dr. Azodo. She was going to share with us, using the example of how Philippines have used the sin tax law to achieve universal health coverage. Could Nigeria be on the cusp of universal health coverage with this financing that is available to it? Until I hear from Dr. Azodo, let me just very quickly go back to Dr. Bagudu and just ask Dr. Bagudu a very pointed question. Madam, you see a lot of patients with cancer every day. How do they access treatment? Where do they get the financing to get treatment? Do they just go home and die? Dr. Bagudu. Otherwise, I'm happy to very quickly go on to Dr. Akinroye to ask Dr. Akinroye, how do people fund treatment of their hypertension, diabetes, in the absence of health insurance coverage?
Thank you, Dr. Olumide. It is very devastating to even think of what happens to people living with cardiovascular disease, and even non-communicable disease. A good example is what happened during the first episode of COVID, when hospitals were shut down, when people couldn't access their drugs, when people couldn't even go out, even to take any of their medications. People with even medications ran out of it, and the cost was skyrocketing. So we lost quite a lot of people. That's why we lost quite a lot of people from hypertension, from diabetes, and from all sorts. And also the health system was just not available. Even to approach the doctors to go to even private hospitals that were available, it was exorbitant. So you can see how that affects the people. They use their out-of-pocket money to be able to to be able to access management or treatment or to buy their drugs. And I tell you one thing, for example, talk of hypertension. It costs virtually, maybe when the last data was done, that in Nigeria, how many people can afford to treat hypertension when you need to take 1 or 2 or 3 drugs even to be able to get your blood pressure stable? And virtually all these drugs are imported to Nigeria. So we really need that people are suffering. And I've just mentioned to you my data as of 2014, about 80 million people are suffering from hypertension in Nigeria. And they depend on drugs from outside the country. So why don't we not have a lot of people with renal failure? Why will you not have people with stroke? And you really need, and there's no funding, just like Dr. Mamora mentioned. But recently, we thank the government, there's now the Basic Healthcare Provision Fund that has just been instituted in states. It is under the leadership of Dr. Mamora. This Basic Healthcare Provision Fund has just admitted cardiovascular and diabetes at the last national meeting or council meeting. The other NCDs are not being admitted. So how many people will be able to access it? So the only way out, go along, strengthen the primary healthcare system so that people will be able to access, even to see doctors and nurses to be able to take their care. And again, access the Basic Healthcare Provision Fund, which has a dedicated account to be able to do it. Not many states have paid their counterpart funding, but we thank God, and I believe Dr. Mamora will work harder to make sure that the 36 states will pay their counterpart funding to the Basic Healthcare Provision Fund. So they are left on their own. If you cannot afford it, then the answer is there. Thank you, Dr. Olumide.
Thank you very much, sir. Two takeaways from you, sir. One is that perhaps the additional revenues raised from the taxes, from pro-health taxes, alcohol, tobacco, and sugar-sweetened beverages, could the Basic Healthcare Provision Fund provide the basis for the health sector to utilize those funds? I believe the jury is still out on that. This was something that Dr. Azodo, Director of Planning, Research and Statistics at the Federal Ministry of Health, was going to speak to specifically. But I know that we still have subsequent sessions where the Ministry of Health would then elaborate on how the health sector will utilize this funding. In fact, I will also ask colleagues and stakeholders on this call to go back to what the Minister of Finance mentioned in the finance briefing for the 2022 appropriation. She actually said that these taxes have been introduced to support interventions in the health sector. And I do hope that perhaps NCDs, primary services, primary healthcare services, some of this will be some of the things that some of these finances might be channeled towards. Let me just very quickly, as we begin to close and round up this webinar, I don't know if Dr. Zena Bagodo is back. If she's not back, I'll just go to Dr. Pamela Ajayi. Last words from you, Dr. Ajayi, President, Healthcare Federation of Nigeria.
Thank you very much. I just want to once again appreciate all those who have pushed and who have made this pro-health tax a reality. But the work is not yet over. And what I'd like to encourage those who are in industry to fight for is, if you want to fight, don't push against the tax. It's already here. Let's push to make sure that it has the kind of impact that would positively impact all of us by ensuring it is used judiciously in our healthcare service, by either providing health insurance for the underprivileged or adding to our infrastructure, providing additional funds, as was said, for specific NCD related challenges. And I would want us to all embrace this particular tax, because it actually affects each and every one of us, because all of us are taking sweetened drinks. If we are not taking it, our children are taking it, our family members are taking it, our staff are taking it, and the impact is there for us to see. I know that we will be having future webinars that will address some of these issues and help those who are perhaps still skeptical to understand a bit more. But I think suffice it to say that this is a good tax. It is a good tax, and let us make sure that it is used to the benefit of all of us. Thank you.
Thank you very much, Dr. Ajayi. I go back to Dr. Bagudu in 1 minute, but I wanted to ask you specifically, Dr. Bagudu. You see a lot of cancer patients today in Nigeria. What happens to them? How do they pay for care? How do they access care, Dr. Bagudu? I mean, if you could just paint a graphic picture of this for us.
Well, the picture is not a nice one. 99.9% of Nigerian cancer patients fund their treatment out of pocket. As we all know, cancer is one of the most complicated diseases to have. It's also indirectly and directly one of the most expensive diseases to treat. Therefore, we're asking an indigent person living in a rural area to buy drugs worth about 600 to 1.2 million naira every 6 weeks to fund his care. Realistically, this is not going to happen. First of all, they present in late stages, and then when they do present, they do not have access to enough funding. They do not have access to the right treatment in the vicinities of where they live, because the treatment facilities are so far and few in between. So this paints a very gory picture. Most of the patients that we see come in late stages. Almost 70% of patients in Nigeria present in the late stages. So for the purposes of this conversation, what I want to reemphasize, I'm going to use the minister's words here, and I'm going to be using it consistently over the next couple of months as we continue to advocate on this issue of the pro-health tax, particularly the sugar tax. We want it to be ring-fenced to the health sector. We must ring-fence these funds to the health sector. He has assured us that they're going to do this, and this is what we want the Ministry of Finance to do, to openly disburse these funds in an effective way so that the people that are suffering from all these diseases can benefit from it.
Thank you very much. I was trying to pick some of the questions from the Q&A box, but I see that quite a number of the questions are from industry, which is doubting some of the scientific observations and scientific publications. The third webinar, I must say, would have a slant towards the scientific evidence. And I will ask members of the industry and opposition who are on this call to please ensure that they're part of the third webinar. The second webinar next Thursday will speak mostly to those in the media and media practitioners. Several of them are on this call, and they need to leave this call also with accurate and good information. And we've had a number of things on this webinar today. First is that this tax is primarily to improve population health. And this is in response to the rising prevalence of non-communicable diseases in Nigeria. That is the primary basis for this tax. Yes, there is a secondary effect of the tax, which is that it raises additional financing for governments, which in itself, it might be small, but it's important, knowing that Nigeria has universal health coverage as the focus of its health systems. And where public financing is important, those monies will be important to Nigeria's universal health coverage aspirations. We also know that pro-health taxes, combines alcohol, tobacco, and sugar-sweetened beverages. In Nigeria today, alcohol and tobacco taxes are already in place before now. 2-3 years ago, Through the same Finance Act, the Ministry of Finance raised the taxes from alcohol and tobacco because for Nigeria, it was some of the lowest. Those taxes on those products was one of the lowest in the world. And now we're happy that Nigeria has joined Kate's map, which is shared, has now joined those countries that have now introduced taxes on sugar sweetened beverages. We must say that the rate that has been mentioned in the Finance Act of 10 naira per litre is extremely low. But even though it is still something that we're happy for. I've been told that Dr. Zodo has joined now, and what a way to end this webinar. We will bring on Dr. Zodo to share with us. Dr. Zodo is Director Planning, Research and Statistics at the Federal Ministry of Health. She is responsible for policies and plans, and in fact, she has been one of the champions for pro-health taxes. She and her team submitted a memo at the last health taxes in Nigeria, and she will share with us how this will align with Nigeria's universal health coverage efforts. Dr. Azodo, you're welcome.
Thank you, Dr. Lumide, and I want to thank everyone on the call. Unfortunately, I had quite a bit of an issue joining this call, but thank God I'm here now. So I think I'm joining at the middle or towards the end, and initially it was a bit of a challenge, but has already been said, we've worked together with the World Bank, Lumide, and the Federal Ministry of Finance, looking at the pro-health taxes. And I mean, there's no gainsaying that the issues around non-communicable diseases and the pro-health taxes, well, the so-called sins that we commit, in driving non-communicable diseases. So there's a need for us at the health sector and health sector players to also look at how we can make those who benefit financially from these food items and other items to chip in something. It's not really a punishment, but to chip in something to ensure that we improve our health. So we have a national strategic health development plan, which outlines, priorities and the areas of funding, which includes the national non-communicable diseases. And as a developing country, we also know that in addition to the communicable diseases, we have very serious rising incidence of NCDs. There was some WhatsApp message that was going around about why are people having so much renal failure, kidney failure, now. And there were a number of suggestions. I'm sure a number of us that are the Medical Women platform will know that. So what government is doing with the pro-health tax is to try and ensure that there are sustainable, opportunities to move funds from areas of concern, from those who benefit from health damaging situations and foods and businesses, who cannot be helped maybe to invest in our health. So that's where we have the issues around health taxes, pro-health taxes. Okay. Now, what is the Federal Ministry of Health doing? What we are doing is to work with the Ministry of Finance and to say, okay, we are very keen as a health sector. We recognize that people must smoke. Maybe our public health messages are not enough. People must smoke, people will take sugar and all of that. Much as we regulate that, they are still in our meals. And so we're now looking, how can we, take some of the tax the people who make this product, who benefit financially from them, to invest in the health sector. Our issue here, like has already been said, it's not just about taxing the makers or and mobilizing pro-health taxes. It is about earmarking those funds for the health sector. Earmarking that fund for the health sector. And in doing that, we recognize that the Ministry of Finance is under pressure. To everybody thinks that their own sector is the priority sector. So give us the money, we have monies in our sector. But we can show, and we have shown, that these activities of these industries that impact directly on our health. And so while there are opportunities for investing in other sectors, we are requesting that these resources should be earmarked for health. I mean, the first lady has spoken, when you have somebody who has cancer, for instance, I just lost a cousin on the 15th of January, to a GI cancer. When you have somebody who has cancer, the cost of treating cancer in Nigeria is so huge that no matter how rich you are, I mean, you have to be one of the billionaires of Nigeria to be able to treat cancer on your own and still not be left impoverished. And that is the same for almost every other non-communicable disease. And all of this can be directly traced to some of the nutritional activities and other health damaging businesses that people have had to engage in, which are also social requirements. And so we are saying in the health sector, yes, you have to do these businesses. Yes, you have to make sugar. People have to take sugar. Yes, you have to make beverages. What we are saying, because of the impact, the taxes from here should be earmarked for the health sector. So we are asking for an earmarking of the proceeds of this tax for the health sector. And that conversation is what I would like all of us here to support the health sector to speak to. So we can now look at the platform for utilizing these funds, once it is mobilized. But we are requesting that the funds should be earmarked for the health sector. The damage is direct, the impact is on point on the health sector. And we have also seen that health in itself, I mean, the COVID has shown that health should be in all policies, because everything that concerns our health damages everything else. It ruins our economy, it ruins even our social life. Everything is affected. So we in the ministry are requesting for an earmark, and we want everyone here to work with us to ensure that the funds that this tax is implemented and implemented judiciously, and that the funds accruing from the tax is earmarked for use in the health sector. We will all work together to look at the platform on which, how people can access the fund and actually utilize it as it is required. Thank you, Dr. Lumide, and I appreciate the opportunity to be on this platform. Thank you, everyone.
Thank you very much, Alagbe Dr. Azodo, Director of Planning Research and Services at the Federal Ministry of Health. Ladies and gentlemen, my apologies. We are 6 minutes, we've gone 6 minutes over the allotted time for this webinar. Like has been announced, we have another one on Thursday where we'll be engaging with those in the media so that we can better articulate our story because there's a lot of opposition coming from industry, and we can see a lot of the comments even on this call. Also, next Tuesday, we will be looking more at the scientific basis for several of the assertions that has been made in the issue of advocating for these fiscal policies. It's been a long and interesting and exciting webinar. We had opening remarks from the Honorable Minister of Health State, Senator Dr. Mamora, who has brought his gravitas to this policy issue. As I said, I know that he's had numerous engagements with the Minister of Finance to ensure that this was captured in the Finance Act of 2021. And this policy objective will remain one of these legacies of the current leadership at the Federal Ministry of Health. We also had Mr. Fola Adeola, who in fact emphasized that having set up PENCOM, there's no equivalent in terms of large-scale health insurance. In other words, if the poor and vulnerable, even those who are in the middle class, are unable to afford health care, then prevention is better than cure. Where there's no adequate public financing, then it's perhaps better to use this kind of fiscal policies to reduce the consumption of all of these harmful products. I have also emphasized that the current rate is in fact very low, and as it is, will not necessarily deter individuals from consumption. So which means that our work is all cut out for us because we now need to advocate for increasing the rate for this product to the point where, in fact, people will begin to take a second decision on whether to buy a bottle of Coke or not. It's been a very exciting time on this webinar today. I want to thank everyone. Just to mention one last comment from me, people are saying for us to have earmarks, then the health sector needs to be ready to show accountable results. I believe this is a topic we will still need to examine further. But yes, Dr. Azodo, we do agree that the health sector should be a recipient of these additional revenues raised. The Philippines have used this successfully to achieve universal health coverage. Vivian, I hand over back to you, Vivian. And thank you so much for all your support and your team.
Okay, thank you so much, Dr. Kunala, for a fantastic moderation of what is a very important issue to all of us. Dr. Kunala has highlighted some upcoming webinars we have on the 27th and on the 1st. And I hope that you will all join us on those upcoming webinars. We're really, really grateful to all the panelists who at very short notice gave up their time this afternoon to join us for an hour and a half to speak on an issue that, affects all of us. And, we can all look at this from the health angle in terms of the benefits of a pro-health tax. But I think I also crave your indulgence to also put on another hat, which is, as parents, what really are the implications of such a sugar-sweetened beverage tax on our children? We all know the rising incidence of NCDs, and with the increase in type 2 diabetes in children, we know that our future generation will not be as healthy as us. So I think we should also reconsider the implication of unhealthy foods and drinks on our future generation of Nigerians. And I think ultimately, collectively, this is really what we should be fighting for, a healthy future populace of our Nigerian youth. So without further ado, just to thank everybody who joined at 2 o'clock and who was able to stay. For those who weren't able to stay, I hope we can share the findings or some of the discussions we had this afternoon with all of you. We will do so in due course. And please do join us over the next 2 webinars that we'll be holding. I think it's important that we also raise public awareness and that we're not just talking to ourselves in the health sector or industry speaking to speaking to each other, but also consumers themselves are empowered with the right information to make the right decision for themselves, their families, and all those who they are custodians of. So I would just, on behalf of my team at Nigeria Health Watch, like to thank you all for joining and look forward to seeing you again in the next 2 webinars we'll be holding. Over.